but you should know about diphtheria, because if you encounter any case of diphtheria, so that immediate treatment can be started. Though we are studying the microbiology of diphtheria, but diphtheria is a clinical diagnosis because you have to start treatment immediately. We cannot wait for the microbiological confirmation. So diphtheria, what is the motto of breeding? That even if you encounter a single case of diphtheria, you can suspect and start the treatment. So before we go to the diphtheria, I have intentionally included the streptococcal pharyngitis. That is the commonest. Let them get in. I have intentionally kept few slides of bacterial pharyngitis of streptococcus or beta hemolytic streptococcus, because that is the commonest differential diagnosis, and that case you will enter many times in your clinical career. But diphtheria you may or may not see in your clinical career a single case of diphtheria after the vaccination has started. So clinical case of diphtheria is very rare. So what are the learning objectives in this class? So that you can learn about diphtheria, you can differentiate between streptococcal pharyngitis and diphtheria, and the diagnostic procedure is almost the same. It is the most common upper respiratory infection you will encounter. Just what are the causes of pharyngitis? That may be bacterial pharyngitis, there may be viral, and among the bacterial pharyngitis, two most important bacteria are beta hemolytic or group A streptococcus and diphtheria. So streptococcus and corynebacterium diphtheria are the two most common organisms. Please don't talk. These are the rare causes of bacterial pharyngitis. Other hemolytic streptococci, group C and group G, Arcanobacterium, Fusobacterium, Mycoplasma and Neisseria. Now streptococcal meningitis is already covered in the last class. So I will just show you a picture of streptococcal pharyngitis and how it is. This is the streptococcal pharyngitis or tonsillopharyngitis. There is a white patch of tonsillar fossa, that is the streptococcal pharyngitis, that is the cause of localized tonsillitis, or it may cause diffuse pharyngitis. So you can see the enlarged tonsils covered with white fibrinous exudate. Now how we will diagnose? The differential diagnosis, as I have told, is diphtheria and viral pharyngitis. So the diagnostic method would be the same, whether it is a streptococcal pharyngitis or diphtheria. Same culture, and that will be gram-positive cocci in chains. Now we come to the today's topic, that is diphtheria. What is the causative agent of diphtheria? Corynebacterium diphtheria. What is the meaning of corynebacterium? Can anybody, what is the meaning of corynebacterium? What is the meaning of corynebacterium? Means club-shaped bacilli. Corynebacterium means club-shaped bacilli, and this is one of the example of gram-positive bacilli. What are the other example of gram-positive bacilli? Can anyone tell the other names of gram-positive bacilli which will you encounter? This is one example of gram-positive bacilli, Corynebacterium diphtheria, or Corynebacterium is the gram-positive bacilli. Other examples are Bacillus species, Clostridium. Bacillus or Clostridium are with spore, gram-positive bacilli with spore. Corynebacterium is non-sporing. Other gram-positive bacilli examples are Listeria and Actinomycetes. So these are few examples of gram-positive bacilli. Now Corynebacterium diphtheria is highly infectious. Corynebacterium diphtheria primarily infects the throat, tonsil and larynx. So that involves the respiratory tract. That is the main causes an exudative pharyngitis and membranous tonsillitis. Now what is the history? In 1826, Pierre Bretonneau give the diphtheros, meaning leather-like. Why he has given a leather-like? When we go towards the next pathogenesis or the disease process, there will be a pseudo-membrane. A leather-like membrane usually forms over the tonsillar fossa. That's why initially the history was first given the name diphtheros, meaning leather-like. First observed by Claves in 1883, first cultivated by Loeffler. So that's why diphtheria bacillus is also called Clave-Loeffler's bacillus. So why it is called a Clave-Loeffler's bacillus? First